Welcome back to Open Line. Tonight we are talking about how COVID-19 legislation can potentially impact Tennesseans with disabilities. And we want to include you in this conversation. We're going to go to the phones here in just a second. We've got a few folks calling in, but also want to remind you that phone number will stay at the bottom of your screen. Feel free to give us a call if you'd like to join in. Now let's go to the phones here. We have Tom. Tom, you are live on Open Line. How are you?
Good evening, ladies. I'm going to tell you right now, I'm not a fan of this governor we have at all. He's a liar and a hypocrite. This is the guy that went on Fox News, Sean Hannity, and said children do not get sick from COVID-19. Now, we've got a medical doctor, Dr. Jason Martin, that's going to be running for governor next year. Let's get behind him and get him elected. Bill Lee has got to go. Thank you very much.
Thank you for your call, Tom. We appreciate it. I'm going to go to my next call here. Donna, you are live on Open Line. Go ahead.
Yes, this is Donna.
Go ahead. We can hear you.
Okay. I just wanted to say that 100 years ago, during the flu pandemic, that people in California were fined if they didn't wear a mask. The people in the East were dying like flies. Woodrow Wilson got the flu, but he was like our political leaders today. He didn't tell anybody. He got it when he went to Europe for a meeting. And, I mean, this is not news. This is 100 years ago. How ridiculous. You're stepping on my toes when you won't wear a mask, and like that's a big deal. Cover your nose and mouth with a tissue. Big deal. I was a nurse and wore a mask every day for 45 years. It will not hurt you. Thank you.
Thank you for your call. I want to bring Carol Westlake back in here, Executive Director of Tennessee Disability Coalition. Carol, obviously those calls speak to how emotional this issue is for folks here in Tennessee and really across the board, even though we've been talking about this for the last year and a half. I mean, strong opinions here, and I'm sure strong opinions that you hear from folks that you work with.
Yeah, we do hear strong opinions, and it is it's challenging, I think, at times for folks. For our community, I think it really is this sense about a sense of community, right? And understanding that we all do have to do some things sometimes that are more challenging than we would like. For parents of kids with disabilities, for example, I mean, I think that, you know, what they tell us is, you know, you generally didn't sign up for this, right? I know of a woman who, a family, mom and dad, and they lost their son just over a year ago. And she said, you know, every time, you know, we end up in the hospital, we end up wearing a mask. She said, when the pandemic hit, she said, oh, I can tell everybody how to clean their home and how to sterilize it, because I didn't sign up for this. But when I had a child with special needs, I learned how to do those things. Do you know? And his grandparents learned to wear a mask, and you know, way before we were talking about COVID. And you know, you do what you have to do. And that's how we keep each other safe, and that's how we keep our loved ones safe. It is the way nurses keep us safe, and while it is an emotional and a political issue, for me, it's an issue of community and about how we care for each other and how we take responsibility for those we love and for those we don't know.
And you mentioned briefly early, you know, wearing masks can be complicated for some individuals with disabilities, depending on what that disability may be. But there is also a way around that in some cases. So it's still something that I guess you believe, or you think parents would support them doing for health reasons. They just may have to get a little creative with it, it sounds like.
Absolutely. Yeah, there are a lot of different kinds of ways to deal with kinds of things. And then some folks, as I said, you know, I do know families and their kids do stay home occasionally, you know, sort of pre-COVID, if there was a particular something going through school, because they just weren't safe to do that. But doing that for a couple of days or doing that for a week is different than being excluded from school or segregated at school because it's not safe.
And, we've heard the term learning loss quite a bit over the last year and a half for just kids across the board, how remote learning impacted them, how any of these circumstances, and I'm sure that may be tenfold for an individual with a disability if they're left out, like you're saying, for an extended period of time.
Yeah, it really is. And I will also say that the other thing that we worry about in our community are mental health issues for kids. I mean, this has really been a difficult time. So I really think that in many ways, grown-ups kind of need to dial down the rhetoric, right? We need to figure out how we get kids in school, keep them safe in school, make everything as normalized as possible during a pandemic, because that's how we're going to keep our kids mentally healthy as well. I mean, I think that, being separated from their friends, the uncertainty, some of the fear that goes on, all of those things have challenged children's mental health, in addition to, these sorts of worries about other kinds of health issues, and learning loss, and make a list. And we don't want this sort of generation of kids to suffer if they don't have to.
Well, despite what may be some legal challenges coming up, the governor has signed this legislation, and so where do we go from here? I mean, what's next for you guys as far as, is this something you obviously will continue to follow, but where do you go from here?
Well, one of the things that we have really tried to do is to help parents think about and practice having conversations about this. I think that we would all do well to know, and those conversations have to happen, I think, in your own neighborhood and in your own school, and one thing and another. And can we sit down and talk about how we do this at Elm Street Elementary School? Doesn't have to go all the way up to the governor. Doesn't have to be, that kind of an issue. Can we talk about how we do this with my next door neighbor, how we do this, with the folks down the street, how we do this with the teachers and the principals that we know and who are part of our lives and part of our community. And those conversations can be tough conversations, but learning how to do that, I think, and being brave to have those conversations is better for all of us. It's real easy to rail at people in Nashville you don't know, right? A little bit harder to look at, your kid's coach in the eye and not be able to have that conversation about how we keep kids safe.
And we know there's a little bit,
really,
yeah, we know there's a little bit of, COVID fatigue factor at this point, when this is all we've been talking about, it seems like, for a year and a half. And how do you kind of keep focused, keep up the fight, keep up those messages that you're trying to get out when it's tough, because I think everyone's kind of beaten down and emotionally exhausted after what we've all been through.
It is. I think people really are worn out, and part of, I think, how you do that is that you do let people know that you're there for support. And that's what we have been trying to do, I think, is that when a parent calls and a parent is really scared and really worried about learning loss because their daughter's only had 8 hours of instruction the entire semester, right? But they're trying to keep them safe. They do need to talk about that, and they need to have somebody to bounce ideas off of, and they just need some emotional support for that as well. And then resources. What are the tools that mom can have to be able to go to her principal, to go to her school, to do whatever, and say, I get that this is really challenging, and I get that this is all, but can we talk about how we're going to make this work? Because my kid is absolutely as important as everybody else's kid. No more important, but no less important. So how do we work to make sure that everybody gets what they need?
And you guys are such an important resource for families with disability, with an individual with a disability. Explain kind of, if they're not familiar with your group or how they can reach you, what all you may provide for someone who could be watching this and maybe has some questions or wants to be able to reach out to you.
Sure, I'm happy to do that. So we have a website like everybody does. It is tndisability.org. You can kind of go www. You can kind of see some of the things that we do. We have a lot of resources there. You can reach out directly to us through that website. Using that same TN disability, you will see us on social media, one thing and another. We have a number of on social media, like on Facebook groups for families to get family support, sort of a family-to-family peer closed Facebook group where families can talk about their ideas and support each other in ways that are not public. I'm happy to have people sort of join that if that's what they're interested in doing. One of the programs at our coalition is called Family Voices of Tennessee, and that really is a family-to-family support network. We do parent-to-parent matching so that people have that kind of emotional support as well as educational support that they need. I think that's really, really important. So looking at Family Voices of Tennessee will also help people get connected that way, and our website would help do that. We actually have a variety of ways that during the pandemic, for a lot of people with disabilities, not just in school, but not just children, but adults with disabilities who were not particularly safe going out. I mean, you may remember at the beginning of the pandemic, there were a lot of grocery stores and other places that had a couple of hours in the beginning of the day, that was just for seniors and people with disabilities to try to keep them as safe as possible. But a lot of people with disabilities really got very isolated during COVID because of fear of getting out, and it's great to get your groceries delivered, but it's also kind of painful to not be able to go to your church or not be able to, get together with friends and to not be out because you didn't feel safe. So we have developed some mechanisms through the coalition and our member organizations for people to get some support either by telephone or by texting, so that there are places that they can reach out, get information they need, but also just have an opportunity to kind of connect, because I think that that's been one of the things that we all have felt a real challenge on during this time is this not being able to connect with people we care about, people we know, or to be able to just reach out in our communities to figure out, sort of what's going on and to do things. So we are happy to have folks participate with us in those ways. We also offer a lot of sort of advocacy training and other kinds of things so that people can learn to work with their legislator if they want to do that. And then one of the things that we're also able to do, because we have 42 member organizations, is really kind of get people to where they need to be if they need particular resources that we don't do or that we're not experts at, but that we can kind of connect. So I think those are things that are really important. I will also say that if you're somebody with a disability or supporting somebody with a disability and trying to kind of figure things out, Tennessee has a great resource. It's called Tennessee Disability Pathfinder. And they have an 800 number, which I probably have in front of me, which I'm happy to give if that help is helpful.
It's okay if you don't have that off the top of your head.
So actually I do. I wrote it down.
I'm impressed. Very good.
Yeah. So it's 1-800-640-4636. And that line is answered by folks who are information and referral experts, and then can kind of help link people to really anywhere in the state to the kinds of supports and services that they might need, and resources. So Tennessee Disability Pathfinder is also a really, really good resource.
And I think there's one thing we've all learned is it's okay to reach out for help after what we've all endured over the last year and a half. We'll be right back with much more on Open Line with Carol Westlake. Stay with us.